All right, Ralph Havens here, physical therapist in Bellingham, Washington, and this is video number 2 in our pain relief for runners and walkers. So if you're dealing with a chronic injury, a chronic problem, this is a way to get some self-treatment, and I encourage you to test your walking and your bending and your moving before, and then do this little exercise, and then test it again and see what's different. So hopefully you've watched video number 1. It gives you the basic of this technique that we're using for this pain relief technique. And if you haven't watched that, there'll be a link in the video or in the blog. And this one is a way to work on a lot of joints all at one time, and the connective tissue, all the ligaments and the connective tissue of the body. So I'm going to sit down and show you this one. Let me just get this set just so. Okay. And so if you've watched the first video, you know that we have this super light touch. Like if you're touching a butterfly, it'd be very, very, very light. You wouldn't want to touch very hard. And just the top of your, you've got your soft neck, and the first bone you feel is your top of your sternum, and you're going to touch it and then bring the pressure up a little bit. But again, it's very light. Touch and up. So light that if you touched any less, you really wouldn't be touching. All right. And now the next part, you could put your fingers of the other hand on your belly button and just touch very lightly and then direct a little pressure up. There you go. That alone is very, very powerful. Test it for yourself just when you're watching a little TV or videos or hanging around with the family. Walk around before and after and see how you feel after you do this. Now, to work on a whole bunch of joints at one time, we can turn the body to the left, and then there's a little technique we use with the eyes, and there's a lot of neuroanatomy and neurophysiology behind this. So message me at ralph@ralphhavens.com, and I can guide you and tell you more about where we found this and how we use this. It's integrated from a lot of different approaches, or a few different approaches. But you turn your body to the left, and then you turn your eyes back to the right, and you hold that for a few seconds. Then you relax your eyes, and you can turn your body a little more to the left. Again, you're touching your belly button and this top of the breastbone very lightly and directing a little pressure upwards. Bring your eyes to the right, and then relax. Turn your body a little more to the left. Bring your eyes to the right, and relax. Bring your body back to the middle. You're still touching very lightly and still directing the pressure a little towards the top of your head. Turn your body to the right, and then bring your eyes to the left, and then relax. Turn your body a little more to the right. Turn your eyes to the left. Bring your body a little more to the right, and your eyes to the left, and then come back to the middle. You can do this a few times a day. You can do it as often as you want. You can do it more repetitions than we just did. You can also just touch these two spots and direct the pressure a little bit up towards the top of your head. And then I encourage you to walk around, stand, walk, bend your body, see what you notice that's different simply from doing this, this very simple exercise. So this is video number 2, and look for the video number 3 and 4 and 5. I believe I'm putting about 5 in this blog post, and this can be found at ralphhavens.com/blog, or just look at ralphhavens.com and look for the blog, and message me directly, ralph@ralphhavens.com. All right, I will see you soon on the next video.